Let's get right into it. So we're going to use the same approach we talked about to make sure that we master Turner syndrome back to back. So we're going to start with a question. And I'm going to read the question for you, and all you need to do is to type in your answers. So you have a 12-year-old who presents to the pediatric endocrinology clinic with concerns of short stature and delayed puberty. Physical examination reveals a height significantly below the 5th percentile for her age. Okay? A webbed neck, a widely spaced nipples. Genetic testing is performed to determine the underlying cause. What is the most likely karyotype associated with this patient's condition? A, 46XX, B, 45X, C, 47XXX, and D, 46XY. What's your answer? Is it A? Is it B? Is it C? Is it D? What is your answer, doctors? What is your answer? Is it A? Is it B? Is it C? Or is it D?
It is B.
Okay. So it looks like a lot of people are going for B. And it looks like people have really mastered it. So that is beautiful. So what is the teaching point here? The answer is B. The answer is B. Why is it B? This patient is presented with Turner syndrome. And Turner syndrome is a sex chromosome disorder. That's the first thing I want us to learn. Turner syndrome is a sex chromosome disorder, primarily caused by the loss of part or all of the X chromosome, leading to the 45X karyotype. 45X karyotype. Now, this karyotype is found in approximately 45% of live births with Turner syndrome. So what I'm trying to say is that Turner syndrome has different karyotypes, but the commonest karyotype is 45XX. We have other karyotypes, but I don't want to worry yourself about it. Don't forget that you are not a geneticist. You are going to write an exam which is at the level of a medical student, right? So don't go too deep in the things you learn. Rather, make sure that the common things you master them. So 45X is not the only karyotype of Turner syndrome. There are other ones. But for the sake of your exam, I want you to master that one. Other karyotypes can also be associated with Turner syndrome, but are less common. So that's why it says, what is the most likely karyotype? So the question is asking that which of the karyotypes of Turner syndrome is the commonest? That's the essence of this question. So what I usually do is that at times I let the questions lead. Then after that, we use the points from the questions to, to learn. So a 15-year-old female is evaluated in the adolescent clinic. Which of the following clinical features is not typically associated with Turner syndrome? Which of the following features is not typically associated with Turner syndrome? A, short stature. B, ovarian insufficiency. C, webbed neck. And D, hyperactivity. What's your answer? What's your answer? What's your answer? Beautiful, 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 beautiful. So a lot of people are going for D, 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 D. And the reason is because Turner syndrome is characterized by a short stature. It's characterized by ovarian insufficiency and physical features such as a webbed neck. Okay. A patient may have low hairline and cubitus valgus. Hyperactivity is not a common feature associated with Turner syndrome. So we've looked at karyotyping. We have also looked at features of Turner syndrome. Okay, good. Next question. A newborn girl is referred to a geneticist due to congenital lymphedema of the hands and the feet and a webbed neck noted at birth. She is small for gestational age. A karyotype analysis is ordered to confirm the diagnosis. Question: in which age group is Turner syndrome most commonly diagnosed? In which age group is Turner syndrome most commonly diagnosed? A, newborns. B, adolescents. C, adults. And D, elderly. Is it A? Is it B? Is it C? Or is it D? What is the correct answer? Stephen says A. Dr. Evans says B. Anthony Obina says A. He's asking a question. Is it A or B? What is the correct answer? The correct answer is A. The correct answer is A. Turner syndrome is often diagnosed in newborns. That's what the literature says. Or during early childhood due to the characteristic physical features and growth patterns. So it is usually diagnosed in newborns. However, some individuals with milder phenotypes may remain undiagnosed until adolescence or adulthood. So when is the commonest time we diagnose Turner syndrome? Newborns, right? Okay. So let's get to a teaching point then. Turner syndrome is a common chromosomal anomaly. It's a very, very common chromosomal anomaly, all right? So remember in the QE1, common things are common. Now, what are some of the clues? Turner syndrome is the most common sex chromosome disorder in females. So that's one thing I want you to write down. Whenever you're thinking about, whenever you are in the board exam and you see Turner syndrome, start thinking female, 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 short stature, ovarian insufficiency. And how will ovarian insufficiency present? It will present as irregular or missed periods, trouble getting pregnant, vaginal dryness. So if I present to you 23-year-old short lady with webbed neck has come into the clinic for assessment and has been trying several times with her partner, but has been unsuccessful in conceiving. Start thinking about Turner syndrome. As I said, short stature, webbed neck, female, think about Turner syndrome. Female, think about Turner syndrome. Female, short stature, webbed neck, female, think about Turner syndrome. So I put it even here. Think Turner, think female. Think Turner, think female. As soon as you see that, you know, it should draw attention to something. Think Turner, think female. Now, there are lots of genotypes. As I've said in the past, there are a lot of genotypes, okay? But approximately 45% of Turner syndrome cases is 45X. That is why we dealt with that particular question, which was talking about the commonest or the most likely karyotype that you will see. 45% of them is 45X.